We work hard all day long, and our sacrifice feels like only a drop in the ocean. But if our individual drops were not in the ocean would be dry.
The beginning of March, it was more steady, we got our first couple of patients, it was fine. By July, August, it was our first surge, and it was a disaster.
In El Paso, we're in the middle, and so it was almost like you were getting it from both sides.
A pandemic started, and I felt the need that I had to volunteer to help the community as much as possible.
By the time we started getting our cases in the United States, the Northeast shut down. We went into a nationwide lockdown.
Early on, that was probably the biggest crisis, was just people being able to get their PPE and feeling safe.
After our first surge hit, I would have to say around September, October, our second surge hit.
On October 13th, I tested for COVID because I wasn't feeling good, and I tested positive. I'm Patsy Terraza Stallworth, and I am a native El Pasoan.
Our mother progressed faster on her symptoms. And what was it, I think 2 days?
2 days after.
She was, in the hospital.
And they put me on a oxygen machine, and I wasn't responding.
For those first 5 days, it just got worse and worse and worse and worse.
So they put me on that high flow and said, if you don't respond to this, the next step is intubation. So I remember laying in bed that dark day thinking it's over, this is it. Because I wouldn't respond, because I felt horrible, because I felt it. I lost my daddy in 2000, and I remember talking to my dad that night and telling him, I'm not ready to go. And then it got so real that I told myself, just go to sleep, close your eyes, don't worry about it. Say a prayer, and that's it. And like I told you, I woke up the next day and I was still there. I grabbed my RPG. I said, here we go. We're gonna fight. And just by the grace of God, just by luck, just by the hope and the faith that you have, these healthcare workers are there to help you. I wouldn't be here if it wasn't for those healthcare workers.
And I can only imagine for the frontline workers working actually with the COVID patients, what type of stress gets put on them and their family life, and how do they manage that coming back in and then showing up the next day
To do it all over again.
All of them were pushed into this environment of nothing that they really signed up for, nothing that they could have really imagined.
Yeah, from housekeeping to dietary to the doctors who have to come into the room and check you and talk to you, although they stand at a distance, and you know why. It's a rude awakening that what you've got is really terrible. And if people get close to you, they may be laying next to you the next day. You realize how serious COVID is.
We really didn't know how much worse it was gonna get. We didn't know if it was gonna get better within a couple of days or if it's gonna get worse. Are we gonna lose more nurses? Are we gonna lose, or how many patients are we gonna lose today? Because all those questions just ran through your head at any given moment, because at any time, it was just do what you gotta do, and let's just hope that we can keep it together. My name is Isai Barrios. I was born here in El Paso, Texas. Been here since, haven't moved. I grew up thinking I was gonna be a pharmacist. I was starting at UTEP. I did my first semester there. Upcoming my second semester, I was actually hit by a car on campus. I was hospitalized for about a week, and after that, that's when I realized that I really don't want to be a pharmacist anymore. I realized because of the nurse there, I remember his name was Gilbert. He was just very diligent in the way that he cared for, not just me, but also my family, especially since my mom, she felt very guilty about it. And so that's when I sort of had a change of heart saying that, no, I think this is a field I want to, because I'm more of a people person. Upon graduating, I went into the neuro ICU at UMC. In March, late March, we were converted to our COVID ICU. We were starting to see a lot of different places in America, starting to get hit pretty bad. We converted to the COVID ICU, and it was just day by day, we took it day by day. At first we were getting maybe 2 or 3 patients. We thought we were in the clear, and then all of a sudden one day we came into work and they said, hey, we need to call more nurses because there's about 15 patients waiting down in the ED that need to be placed in a COVID ICU. There was one patient that, I loved her. I mean, if I had to say, I really loved her. She was so sweet to me. She was a fighter. I mean, I looked at her and I said, you're gonna make it, come on. Like, you gotta do it with me, come on. We're gonna get you out of here. And her husband was actually also admitted in the hospital. And he was getting better, but she was just getting progressively worse. It was to the point where I tried everything, I would flip her even though she was just on a regular high flow, she was still able to talk to me. I would sit there and I would feed her while she was laying down on her stomach, trying everything, doing little exercises with her, and she just couldn't. Her body just couldn't handle it. Luckily, we were able to get her husband to come see her, a little bit before he was discharged, so that way he could spend time with her, Because, I mean, of course, you would also think that having your family in there will help. Just that loving touch, will actually get you a little bit better. So we would bring him in, he would talk to her. Of course, he was sad because I think he knew what was gonna happen next. And sure enough, he was discharged, and I don't know how or why, but she passed away the very next day. And, going in and having to, look at her, seeing someone that you talk to. I mean, it's still like, it gives me like goosebumps to this day. You look at her and you just wish you could have done more, but you know that no matter what you have done or what you could have done, COVID was just such an ugly disease.
When we had the surge in November, especially, I think that's when I give them immense kudos, because going from having 30 people in your hospital to having 130 within 7 days, nobody's ever experienced that, right? And they just kept on going. And the nurses, respiratory therapists.
Everybody started to work together and help each other in ways that we never would have thought before, literally to the point of, hey, I have a ton of stuff, let me help you, and I'll bring over a box to you.
People stepped up, the nurses stepped up, the respiratory therapists stepped up, pharmacy, engineering. And again, this was happening across the community. And we would pick up the phone, building those relationships with our resources that were out there and the people that were out there to help us, and just picking up the phone going, what are you doing about this?
This pandemic taught me how to be a little bit more empathetic. It made me realize that it's not just one discipline. It's about everything. It's about teamwork. It's about, and not just like how we work together, but how we support each other.
When you go through something like that, I think it kind of reaffirms like the priorities in your life and the importance of people, of connection, of relationships. And I think that's El Paso's strong point.
I feel like I'm more appreciative of everything around me, from as little as seeing my family even for a little bit, or a simple hello from a stranger. Knowing that I could still help somebody even at their last moment. It was hard because you knew you were gonna come in and someone was gonna pass away, but knowing that you were there for someone at their last moment when their own family couldn't be, that gave me peace of mind, because I know if it were me, I would want my family there, but if they couldn't be there, I would want someone to care as much and go in there and give me what my family couldn't at that time. So knowing that I could be that mediator and going in there, caring for them, you know, and even making them feel loved at their last moments is what really kept me going and not just wanting to quit. You know, and then the help and the trust from my coworkers, you know, that also really helped me continue just showing up and knowing that we helped each other and we helped these patients. Even if they took their last breath, you know, I'm glad that we were there, you know, because we cared for them until the very end.
This is a chance to celebrate El Paso superheroes, the women and men across El Paso who work the COVID front lines in so many capacities. The doctors, the nurses, the technicians, janitors, all the support staff. You are the El Pasoans of the year. You've put yourself in harm's way, and not just in an instant, but day after night after day and the next night. Most of us can only imagine. You've carried El Paso through this pandemic, and on behalf of the El Paso community, we want to say thank you, so that you know your community appreciates you, that while we may never be able to fully grasp it, we do recognize what you've been through.